If you're suffering with back pain, pelvic floor issues, diastasis recti, this is an amazing exercise that you can do to help mobilize the abdominal fascia, as well as if you have that separation of the abdominals, it helps to loosen the fascia in order to allow that tissue to come back together. It brings more awareness to this space. It can help our posture. It can help our breathing. It is so amazing. So this is a melt technique. Grab a Pilates ball or a kid's ball. You're going to become laying on the ground. Pretend that your abdominals are broken into, like, let's say 6 quadrants. We're going to start at the lower right side. Find your hip bone. You're going to place the ball right onto the inside of that hip bone. So it's going to be in between the pubic bone and the hip bone. And you're just going to take 5 to 10 deep breaths. If you want to go deeper, you can lay all the way down. But if that's too intense, you can just stay rested on your elbows. You're going to, again, find deep breaths here and feel your fascia melting over the ball. This is such an amazing exercise, and this is just not a common area that we tend to do myofascial release. Awesome. We're going to move in the direction of the digestive system. So we're going to move to the upper right quadrant, right underneath the ribs. Good. And find that breath. Again, you can come all the way down. Find those long exhales to really melt over the tissue. This will help with rib mobility if you have rib flare. This will help to optimize the diaphragm. But really, you're just looking for any tender areas, and this will really help to loosen that area up. Awesome. You'll take 5 breaths there. I'm moving a little bit faster, but then move to the middle of the abdominals. If you have a diastasis and this feels uncomfortable, stay just to the outside of the center of where the linea alba is. That's that line that has some of the separation of the 6-pack abs. So you'll just stay to the left or right of that. But it can feel really good to get right underneath the sternum, right where the angle of the ribs are. It can feel really, really good. Or if you do have that diastasis, you can come up just a titch higher right on the sternum and right below. And there can be a lot of power there and tenderness. So again, be easy on yourself. Stay focused on the breath, allowing the release. We hold so much trauma, I guess, in our abdominal wall. And when you start to open that up, just like you do with the hips, you can cry, you can just have odd emotions. I've had people laughing, who knows, but you're just going to let it come up. And then you're going to move to the left ribs. So left upper quadrant. If there's an area that you want to stay on a little bit longer, I invite you to do that. Get intuitive with this exercise and just start to feel what feels good. All right, and then we're going to take it down into the left lower quadrant. I never usually place it directly over the belly button. There's a lot of vasculature and lymph nodes that lie right behind that belly button and right above. And so just be aware of that area. That I'm not saying it's never a no, but I would say that in most individuals, start here first and see how that feels, and see if you don't get an alleviation of some of your symptoms. And then last but not least, we're going to find the pubic bone, and we're going to go right over the pubic bone. You can rock back and forth. This is that womb space. If you have any leaking, it can feel like you have a lot of tension here. Again, taking 5 deep breaths. Again, you can come all the way down. That's going to be more intense for you. Or you can stand your elbows. If you have any pain here, of course, stop and talk to your provider about all about adjusting the exercise. Awesome. And when you're done, you're going to slowly just roll to the side and come back up.